Hello and welcome to our video on hot flash remediation. If you are a woman going through menopause, you know how uncomfortable and frustrating hot flashes can be. In this video, we will talk about 8 remedies you can try to reduce the frequency and severity of hot flashes. What is hot flash? The medical term for hot flash is vasomotor symptom, which refers to the sudden dilation and constriction of blood vessels in the body that occur during a hot flash. The main reason for hot flashes is a decrease in estrogen levels in women, which typically occurs during menopause. Estrogen plays a role in regulating body temperature, and when its levels decrease, it can trigger a response in the hypothalamus, the part of the brain that controls body temperature, leading to a hot flash. However, hot flashes can also occur in men and women who are not going through menopause, for various reasons. During a hot flash, a person may feel a sudden sensation of heat that spreads throughout the body, causing sweating, flushing of the skin, and a rapid heartbeat. Other factors that can trigger hot flashes include stress, certain medications, caffeine, alcohol, spicy foods, and smoking. Number 1. Hormone replacement therapy. Hormone replacement therapy, known as HRT, is a treatment that involves taking medication to supplement the hormones that the body stops producing during menopause. HRT can involve taking estrogen alone or in combination with progesterone. It can be taken in the form of pills, patches, creams, gels, or vaginal rings. The goal of HRT is to relieve the symptoms of menopause by replacing the hormones that the body is no longer producing. While HRT can be effective in reducing the symptoms of menopause, it does carry some risks. Studies have shown that HRT may increase the risk of breast cancer, heart disease, stroke, and blood clots in some women. For this reason, HRT is not recommended for everyone and should only be used under the guidance of a healthcare provider. Number 2. Mind-body techniques. Mind-body techniques such as meditation, deep breathing, and yoga may help reduce the frequency and severity of hot flashes by reducing stress and promoting relaxation. Mind-body techniques are practices that focus on the connection between the mind, body, and spirit to promote physical and mental health. These techniques aim to help individuals manage their thoughts, emotions, and physical sensations to improve their overall well-being. Meditation involves focusing the mind on a particular object, thought, or activity to achieve a state of relaxation and mental clarity. Deep breathing involves taking slow, deep breaths to calm the body and reduce stress. Yoga and Tai Chi are physical practices that combine movement with deep breathing and meditation to improve strength, flexibility, and balance while promoting relaxation. Mindfulness-based stress reduction involves paying attention to the present moment and accepting it without judgment. This practice can help individuals become more aware of their thoughts and emotions and develop greater resilience in the face of stress and difficulty. Overall, mind-body techniques can be a valuable tool for promoting overall health and well-being and can be incorporated into daily life to reduce stress and improve mental and physical health. Number 3. Acupuncture. Acupuncture is a traditional Chinese medicine practice that involves the insertion of thin needles into specific points on the body. Some studies have found that acupuncture can be effective in reducing the frequency and severity of hot flashes in menopausal women. According to traditional Chinese medicine, acupuncture works by stimulating the body's energy flow, or qi, and correcting any imbalances in the body's energy pathways. From a Western medicine perspective, acupuncture may work by stimulating the nervous system and releasing natural painkillers and other chemicals in the body. During an acupuncture session, the acupuncturist will insert thin needles into specific points on the body, which may include the wrists, ankles, or back. The needles may be left in place for several minutes to up to an hour and may be gently stimulated to enhance their effects. Some studies have found that acupuncture can reduce the frequency and severity of hot flashes, as well as improve other menopausal symptoms such as mood changes, insomnia, and vaginal dryness. However, more research is needed to fully understand the potential benefits and risks of acupuncture for menopausal symptoms. If you are considering acupuncture for hot flashes or other menopausal symptoms, it is important to talk to a licensed acupuncturist and your healthcare provider to discuss whether it's a safe and appropriate treatment option for you. Number 4. Dietary changes. Some women find that avoiding certain foods and drinks, such as spicy foods, caffeine, and alcohol, can help reduce the frequency and severity of hot flashes. Eating a diet high in plant-based foods may also be helpful. Please check our video on hot flashes during menopause, causes and the foods to avoid and the foods to eat, to know more about the diet. The video link also given in the description. Number 5. Regular exercise. Regular exercise can help reduce the frequency and severity of hot flashes by promoting overall health and reducing stress. It is recommended to aim for at least 30 minutes of moderate intensity exercise on most days of the week. It is important to choose an exercise that you enjoy and that fits your individual needs and preferences. If you are not sure where to start, consider working with a certified personal trainer or fitness professional who can help you create an exercise plan that is safe and effective for you. Number 6. Cooling techniques. Keeping cool can help alleviate hot flashes. Some women find that keeping a fan nearby, wearing breathable clothing, using cooling sprays, and drinking cold beverages can help. Using cooling pads or taking a cool shower or bath may also provide relief. It is important to note that while cooling techniques can be helpful in reducing the discomfort of hot flashes, they may not be enough to fully eliminate hot flashes altogether. Number 7. Hypnosis. Hypnosis is a technique that is used to create a state of deep relaxation, focus, and suggestibility. During a hypnosis session, a trained practitioner guides the individual into a state of deep relaxation, often using techniques such as guided imagery, visualization, or progressive muscle relaxation. Once the individual is in this state of deep relaxation, the practitioner may make suggestions to help the individual address specific issues or concerns, such as reducing anxiety, managing pain, or improving sleep. The individual remains aware and in control during the session and can choose to come out of the hypnotic state at any time. Some research suggests that hypnosis may be a helpful technique for reducing the frequency and severity of hot flashes in women experiencing menopause. For example, one study found that women who underwent hypnosis experienced a significant reduction in the frequency and severity of hot flashes compared to a control group. It is important to note that hypnosis should always be performed by a trained and licensed practitioner and should never be used as a substitute for medical treatment or advice. Number 8. Medications. Certain medications, such as antidepressants and anti-seizure drugs, can be effective in reducing hot flashes. These medications are typically prescribed off-label for this purpose, meaning they are not specifically approved by the FDA for the treatment of hot flashes, but may be used by healthcare providers to alleviate this symptom. It is important to speak with a healthcare provider about the risks and benefits of using these medications for the treatment of hot flashes. In conclusion, hot flashes can be a challenging symptom of menopause, but there are some remedies you can try to alleviate them. Mind-body techniques, cooling techniques, dietary changes, regular exercise, herbal supplements, and medications are all potential remedies that can help. It is important to speak with a healthcare provider before starting any new treatments or supplements, and to explore different options to find what works best for you. Please click the links on the description to find some useful products to deal with hot flash. Thank you for watching, and we hope these remedies will help you find relief from hot flashes.